What are the cardinal features of diabetes? The three cardinal features which have been described are polyuria, polydipsia and polyphagia. The high blood sugar in the blood passes into the urine along with water, and the loss of water and blood sugar leads to dehydration in the body. This loss of excess water in the urine is called polyuria. Because of the dehydration, there is an excess of thirst that the person may feel. This is called polydipsia. And the brain senses that there is an inadequate energy in the body and the body requires more food, and therefore brain sends a strong signal to eat, and this results in excess of hunger to the patient, which is called polyphagia. The high blood sugar which is thrown in the urine causes concentration of glucose in the urinary bladder. This can lead to lot of urinary infection. The muscles, as we discussed, receives less energy and therefore the bulk of the muscle can decrease, and this results in atrophy of the muscle called myopathy. Consequently, the fat mass increases and therefore the patient will have a decrease in the muscle bulk and an increase in the overall body fat mass. Decrease in the muscle mass increases blood sugar, increase in the fat mass increases blood sugar. When the blood sugar is high, the bacteria also uses blood sugar for its multiplication and growth. Hence, the bacteria multiplies at a much faster and an exponential rate, and therefore a mild infection may increase within a few hours to a few days to become a very severe infection. Almost any organ of the body can get infected in the presence of diabetes, especially uncontrolled diabetes. Common infection occur in the respiratory, urinary, skin and the gastrointestinal tract. If there is a chronic uncontrolled blood sugar, end organ damages can take place. This can lead to damage in the eyes, heart, kidneys, nerves, brain, etc. In the eyes, two things commonly occur. The first complication is cataract, which may require surgery, and secondly, the retina of the eye can get damaged, and this is known as diabetic retinopathy. Diabetic retinopathy requires laser photocoagulation. In the kidneys, the first sign of failure is throwing out of micro amounts of proteins in the urine, which is called microalbuminuria, which can be easily tested and identified. Later on, when the blood sugar remains high, there develops chronic renal failure. Chronic renal failure may require hemodialysis. The nerves of the hands and legs can get affected, which is called peripheral neuropathy. Peripheral neuropathy manifests as tingling feeling in the feet and later on in the hands also. The brain can get affected, leading to strokes, that is paralysis, and multiple small vessels can get blocked inside the brain, leading to loss of memory called dementia.